there. How are you today? Good, good. So, it looks like this is your first time at the ASMR medical clinic. Yeah? Well, I'm Dr. Shanny. It's a pleasure to meet you. Welcome, welcome, welcome. So, before we get started, I'll just need to verify some information with you for our records. Is that okay? Alright. What is your first and last name? Okay. And can you spell the last name? Okay. Okay. Good, good. I understand. No one ever gets my last name correct either. Okay. And can you verify your date of birth? Okay. The year as well. Very good. Okay. And what is a good phone number for our file? Okay. And is that a mobile number? Okay. And your address, it looks like we have it, but there might be an issue with the spelling of your street. Okay. And can you just verify that zip code? Okay. And do you want to give us an email address for our customer portal? That way we don't have to send you any statements or anything in the mail. We can go completely paperless. Yep, you'll just get some emails from us regarding statements and anything that's updated to your account, like your health records and stuff like that. Yeah. Okay, perfect. What is your email address? Okay. And that was at, okay. Very good. Now, since you're new here, I will need a emergency contact. I know you're just here for, it looks like, your yearly physical exam, right? Yeah, no, this is just for us to have on record in case you come back for any future visits or anything like that. Okay. And their last name? Okay. And what is your relationship with this person? Okay. And a good phone number we can reach them at. Very good, okay. Now, I believe we have all the information we need. Almost forgot. What is your insurance provider? Okay. And the group ID? Very good. Okay. All right. That should be all the personal information I need for now. I hope that wasn't too much. I didn't make you uncomfortable. Okay. We do typically get that information before you come into the office here, but I know our secretary's been out, so I appreciate you being accommodating. I see that the nurse already checked your height and your weight, so we have that. That is good. Okay. Now, let's get a little bit of your medical history. Have you ever had any migraines or any headaches? Okay. And what would you say your diet's like? Okay. That isn't bad, but we probably could work in a couple healthier decisions. But can't we all? And are you good at staying up with the water you should be intaking? Okay. Definitely want to try to get in a couple more glasses of water a day. All right. And do you exercise? Okay, about an average amount. What do you do for exercise? Okay. Yeah, as long as you're out walking, that counts as exercise, so very good. And do you have any allergies I should know about? Okay. Any latex allergies? Okay. Are you currently sick or in any pain? Okay. Have you ever had any major surgeries or any recent trips to the hospital? Okay. And does anyone in your family have any history of maybe like high blood pressure, diabetes, cancers? Okay. Okay. And do you drink or smoke? Okay, like recreationally? All right. And how long have you been drinking or smoking? Okay. Are you currently on any prescription drugs or any medications or anything that I should be made aware of? Okay. And how often? Okay. Do you wear contacts or have any prescriptions for glasses? Okay. Okay. Is there anything else you want to let me know or make me aware of before we get started? Okay. Well, don't worry. If at any point you remember anything, or if at any point throughout this appointment you have any questions, feel free to stop me and ask me or let me know, and we'll go from there, okay? All right, that sounds great. So, I'm just going to set my clipboard down. And we'll go ahead and get started. Let me explain a little bit about how this is going to work. So, I'm going to start by getting your temperature. We'll go ahead and get your blood pressure, we'll listen to your lungs, get your heart rate, and then we'll go ahead and we'll go into the exam. Okay? And we'll just be checking out your facial muscles, your eyes, your tongue and throat, your ears. And I'll have you look at my little eye chart here. Yep, and some of your reflexes, and if all is well, I'll just have you leave a urine sample and then you can be on your way, okay? All right. And again, if at any point you have any questions, go ahead and stop me and feel free to ask. Sound good? All right. So, I'm going to start by sanitizing my hands. Yeah, working in a doctor's office, you can never be too safe. Okay. So tell me, when's the last time you had a physical? Okay. Yeah, it's good to stay on top of them just to make sure you're in peak physical condition for your, your age and everything, and just make sure everything's checking out. So, I'm also going to put on some gloves. You said you didn't have any allergies, right? Okay. Just gonna grab a couple of these. So you're new here. How did you find our office? Okay. Well, it's good to have you. Were you able to find it okay? Yeah. We're not too hard to find. A little tricky. So, let's start by taking your temperature. I have a thermometer right here. And I'm just going to want to put this underneath your tongue. So go ahead and open real wide and say, for me. Very good. Okay. Go ahead and close down. And we'll just wait for that to beep. Okay. There it goes. Okay. 98.7. Very good. No fever. So, let's take your blood pressure next. I have my cuff right here. Oh, okay. Well, don't worry. It's getting your blood pressure taken isn't my favorite thing as well, but as long as you focus on your breathing and try not to focus on the cuff, it'll all go well. And if it's a little high, we can always retake it at the end of the appointment. Okay? So I'm just going to have you roll up your sleeve for me. Very good. Okay. Just put that on a little tight here. Is that okay? Okay. And okay. 120/80. All right. So I'm just going to listen to your heart and your lungs. I have my stethoscope right here. It may be a little cold. I hope that won't be too much of a problem. So, I do have to get a little close for this. Is that going to be okay? Alright. I'm going to have you lift up your shirt for me a little bit. Very good. And, alright. I'm going to have you take a deep breath in. Hold it. 1, 2, 3. And release. And again. And release. And again. And release. And again. And release. Okay, that sounded good. I'm just gonna go in the back and listen to your lungs, okay? Okay, so go ahead and take a deep breath in for me. Hold it. 1, 2, 3, and release. And another deep breath in for me. Hold it and release. And another deep breath in. Hold it and release. And another deep breath in. Hold it. 1, 2, 3, and release. Okay, that sounded very good. Your lungs sounded clear and your heart sounds very strong. I am going to go ahead and get your heart rate. So, actually, I'm going to take your wrist here. Thank you. And we'll give it about a minute. And I'm just going to listen to your heart, okay? All right. You're doing well. Okay. That was very good as well. So far, you seem incredibly healthy. So, I'm just going to go ahead and put that on your chart here before I forget. Okay. Temperature, lungs sounded good, heart sounded good, and blood pressure. All right. Do you have any questions for me so far? No? Well, then let's get started on your exam. I'm actually going to start by feeling your face, just like your muscles around your face. Is that okay? Right. And yeah, I'm a little short. I apologize. Okay. Everything's feeling good. Can you go ahead and smile for me really big? Okay. Good. And go ahead and frown for me. Good. Okay. Can you puff up your cheeks really big? Looks good. And how about a kissy face? Very good. Okay. I do want to check your reflexes there real quick, so if it's all right with you, I'm going to put 2 fingers right here, and we're going to give it a little whack and see how you respond. Okay? All right. Here we go. Okay, one more time. Very good. So looking good, everything's feeling good. Okay. I'm going to feel around your neck, just checking your lymph nodes and yep, okay. Go ahead and make a swallowing motion for me and gulp. Okay, good. Okay. All of that feels great. And everything feels good to you with your facial muscles and neck and yeah. I am going to run a quick test. I just want to see. I have a sharp little point right here and a Q-tip. Just a standard Q-tip. And what I'm going to do is have you close your eyes. And I'm going to touch a part of your face with either the pointy side or the Q-tip. And I just want you to tell me where on your face I touched and if it was pointy or soft, okay? Does that make sense? Yeah? Okay. Go ahead and close your eyes for me. Very good. Here we go. Good. Forehead and pointy. Nose and Q-tip. Cheek and point. Chin and Q-tip. Cheek and Q-tip. Forehead and Q-tip. Nose and Q-tip. Nose and point. Very good. Cheek and Q-tip. Chin and point. Forehead and point. Cheek and point. Nose, boob, and Q-tip. Exactly. Very good. Yep, everything seems to be responding perfectly. I'm not seeing any issues. So, let's go ahead and move on to the next portion of the exam. We're just going to check out your eyes. And do you have any problem with your sense of sight or anything that you've noticed? No? Okay. Well, I have a little light right here. And I'm just going to look into your eyes and see how your pupils dilate, okay? Alright. Okay. Other eye. Okay, good. Next, I'm going to put my hand right here, and I'm going to swing the light from eye to eye just to see how they respond. All right? All right. You're doing good. Yeah, I know it can be a little bright. I apologize. Okay. Good. I'm just going to get a little closer. Okay. Everything looks good. All right. And the response to the light is good. All right. I'm going to have you follow this light for me. So what you're going to do, sit tall and pretty, which you're already doing exactly. Try to keep your head and your neck still, as well as your shoulders. And all I want you to do is move your eyes while you follow the light, okay? Okay, here we go. Try not to move your head. Very good. Okay. Good. You're doing a great job. Just keep following the light. Good, good, good. Okay. Now on a scale of like 1 to 10, how 10 being hard, 1 being easy, how was that? Okay. Well, very good job. Next thing I want you to do is go ahead and have you follow my pen here. Here it is. I want you to stare at the point and just follow it as I move it, okay? Again, keep your head, neck, and shoulders still. Follow it with your eyes, okay? All right, here we go. Good. 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 Mm-hmm. Good. And little cross-eyed. Great job, though. Great job. All right. For this next one, I just want you to stare right here at my nose. And again, keep your head, neck, and shoulders still. I'm going to hold up my hands over to the side. And all I want you to do is to tell me on which hand I'm holding up some fingers and how many fingers I'm holding up, okay? Okay, here we go. Ready? 1, good. 3. 3 again. 4. 5. 2. 1. 1. 3. 4. 3. 2. 5. 1. 1 on each hand. 3 and 4. Great job. We're almost done with eyes. I do have one more exam I like to do. So, this one tends to be everybody's favorite. I have this cute little spatula right here. And I'm just going to have you cover one eye at a time. And you're going to read the lines I point to, okay? Yep, easy as it is. Okay, here you go. Very good. And go ahead and cover the right eye first for me. Good. All right. Let's get started. All right. Good. Good. T-O-Z, right? L-P-E-D. Very good. Okay. Yeah, we're not going to do the whole sign. It's not really an eye exam. You're just here for your yearly physical. But go ahead and switch to your left eye. Ready? Okay. All right. E. F. P. T-O-Z. L-P-E-D. P-E-C-F-D. Great job. All right. I'll take that back. Thank you. All right. So great job on your eye portion. Do you have any questions for me so far? No? Okay. Let's go ahead and I'm going to take just a quick peek into your mouth for me. Go ahead and open up real big and just say, ah, and stick out your tongue. All right. There we go. Okay. Everything looks good. Okay. And you don't have any problem with your taste buds or your tongue or salivation, swallowing? No? Alright, well then we'll leave it at that. So next, I'm just going to take a quick look into your ears. Have you noticed any problem with your hearing or hearing loss or like tinnitus, no ringing in the ears? Okay. All right, well, if it's okay with you, I'm just going to take a quick look into each ear. All right. Hold still for me. I'll be right back. Okay, I'm just going to take a quick peek into this ear here, and everything is looking good. There seems to be a little wax buildup, but nothing, some eardrops from like the pharmacy or some peroxide couldn't help get rid of. Okay. And now we're just going to check this side. Everything looks good. Not as much wax buildup in here. This one looks a little bit better. Okay. Okay, so everything looked good in both of your ears. I did notice that in your left ear, there was a bit more of a wax buildup than in your right ear. Yeah, nothing to be worried about. Like I was saying, it can be cured with some quick, easy drops, like from an ear solution at the pharmacy, or you can use some like 70% like hydrogen peroxide. Yeah, a couple drops, let it sit for like 5 to 10 minutes, and then just let it all drain out. Okay? Any questions? All right. So, for this last part of the hearing exam, I just want to make sure that you're hearing everything okay. All right, so I have my tuning fork right here. I'm just going to give it a little whack, hold it up to your ear, and all I want you to do is just tell me when it stops, okay? Okay, here we go. Yeah, it does have a nice hum to it. Very good. And again. Good. And again. Good, and one more time. Very good job. Okay. Okay. It seems like you heard everything well. Yeah. Good. Did you notice anything uncomfortable or no? Okay. Well, so far everything's been amazing. You've been passing with flying colors. For this next and last portion, I'm just going to want to feel your muscles and check some quick reflexes. Is that okay? All right. I'm going to have you roll up your sleeves for me. Very good. And I'm just going to feel your arm muscles and your nerves. Can you feel that? Good. Now, have you had any injuries or wounds or surgeries that I should know about here? No? Okay. Everything's feeling good. Go ahead and turn your palms face up for me. And how does this feel? Good. Ticklish. Sorry. Other side. Good. Okay. That all feels good. So, you go ahead and roll your sleeves back down. I'm just going to feel your leg muscles and then we'll check your knee reflexes, okay? All right. Do you mind if I get a little close? Okay. Here we go. Okay, so let's just feel here. That all feels good. Any pain or tenderness, any bruising? No? Okay, I'm going to get the other side. Okay, and how is this side feeling? Good. Okay. And no tenderness, soreness, bruising. All right. Okay. Wow. All of that looked good. Let's just check your reflexes here. Just have this, and I'm going to give your knee a little whack, and we'll see how you respond. No, it's It's not going to hurt, I assure you. At least not bad. Okay? Okay, here we go. 1, 2, 3. And again. 1, 2, 3. Good. Other side. 1, 2, 3. And 1, 2, 3. Very good responses. Okay. Well. Everything looks great to me. You had good blood pressure, good lungs, heart rate. Eyes dilated nicely. Throat looked good. Facial muscles, reflexes. Good, good, good. Do you have any questions for me? No? Alright, well, if you don't have any questions or anything you want to discuss, everything looks good to me. You're looking in peak physical condition. I will have you go out to the counter and I'll give you a slip to give the nurse to check out. And she'll also give you a cup to leave a urine specimen, and we'll call you if we find anything, okay? All right. Well, it was a pleasure meeting you. I hope to see you again in the future. And I hope you have a great rest of your day. Bye.